Type 2 diabetes. What are the early signs of type 2 diabetes? Hello everyone, welcome back to MyBetterMe channel. Before we dive into early signs, symptoms, causes, risk factors and treatments of type 2 diabetes. If you are interested in proven ways to prevent or control diabetes, losing weight or improving your overall health in general, which I know you are, make sure you like and subscribe to our channel to get more awesome and helpful weight loss and overall health videos like this one. Alright, let's dive right into it. What is type 2 diabetes? Type 2 diabetes is the most common type of diabetes. It is a chronic condition in which blood glucose, sugar, can no longer be regulated. There are two reasons for this. First, the cells of the body become resistant to insulin, insulin resistant. Insulin works like a key to let glucose, blood sugar, move out of the blood and into the cells where it is used as fuel for energy. When the cells become insulin resistant, moving sugar into the cells requires more and more insulin, and too much sugar stays in the blood. Over time, if the cells require more and more insulin, the pancreas can't make enough insulin to keep up and begins to fail. Type 2 diabetes used to be known as adult-onset diabetes, but today more children are being diagnosed with the disorder, probably due to the rise in childhood obesity. There's no cure for type 2 diabetes, but losing weight, eating well and exercising can help manage the disease. If diet and exercise aren't enough to manage your blood sugar well, you may also need diabetes medications or insulin therapy. Type 2 diabetes causes a person's blood sugar levels to become too high. Recognizing the early signs and symptoms of this chronic condition can result in a person getting treatment sooner, which reduces the risk of severe complications. Type 2 diabetes is a common condition. A 2017 report from the Centers for Disease Control and Prevention, CDC, found that 30.3 million adults in the United States have diabetes. The report also estimated that another 84.1 million US adults have prediabetes. People with prediabetes have higher than normal blood sugar levels, but doctors do not consider them to have diabetes yet. According to the CDC, people with prediabetes often develop type 2 diabetes within 5 years if they do not get treatment. The onset of type 2 diabetes can be gradual, and symptoms can be mild during the early stages. As a result, many people may not realize that they have this condition. Uncontrolled type 2 diabetes can lead to chronically high blood glucose levels, causing several symptoms and potentially leading to serious complications. In this video, we look at the early signs and symptoms of type 2 diabetes and the importance of early diagnosis. We also discuss the risk factors for developing this condition. Symptoms of type 2 diabetes. In type 2 diabetes, your body isn't able to effectively use insulin to bring glucose into your cells. This causes your body to rely on alternative energy sources in your tissues, muscles, and organs. This is a chain reaction that can cause a variety of symptoms. Type 2 diabetes can develop slowly. The symptoms may be mild and easy to dismiss at first. The early symptoms may include 1. Frequent urination. When blood sugar levels are high, the kidneys try to remove the excess sugar by filtering it out of the blood. This can lead to a person needing to urinate more frequently, particularly at night. 2. Increased thirst. The frequent urination that is necessary to remove excess sugar from the blood can result in the body losing additional water. Over time, this can cause dehydration and lead to a person feeling more thirsty than usual. 3. Always feeling hungry. Share on Pinterest. Constant hunger or thirst can be early signs of type 2 diabetes. People with diabetes often do not get enough energy from the food they eat. The digestive system breaks food down into a simple sugar called glucose, which the body uses as fuel. In people with diabetes, not enough of this glucose moves from the bloodstream into the body's cells. As a result, people with type 2 diabetes often feel constantly hungry, regardless of how recently they have eaten. 4. Feeling very tired. Type 2 diabetes can impact on a person's energy levels and cause them to feel very tired or fatigued. This tiredness occurs as a result of insufficient sugar moving from the bloodstream into the body's cells. 5. Blurry vision. An excess of sugar in the blood can damage the tiny blood vessels in the eyes, which can cause blurry vision. This blurry vision can occur in one or both of the eyes and may come and go. If a person with diabetes goes without treatment, the damage to these blood vessels can become more severe, and permanent vision loss may eventually occur. 6. Slow healing of cuts and wounds. High levels of sugar in the blood can damage the body's nerves and blood vessels, which can impair blood circulation. As a result, even small cuts and wounds may take weeks or months to heal. Slow wound healing also increases the risk of infection. 7. Tingling, numbness, or pain in the hands or feet. High blood sugar levels can affect blood circulation and damage the body's nerves. In people with type 2 diabetes, this can lead to pain or a sensation of tingling or numbness in the hands and feet. This condition is known as neuropathy, and it can worsen over time and lead to more serious complications if a person does not get treatment for their diabetes. 8. Patches of dark skin. Patches of dark skin forming on the creases of the neck, armpit, or groin can also signify a higher risk of diabetes. These patches may feel very soft and velvety. This skin condition is known as acanthosis nigricans. 9. Itching and yeast infections. Excess sugar in the blood and urine provides food for yeast, which can lead to infection. Yeast infections tend to occur on warm, moist areas of the skin, such as the mouth, genital areas, and armpits. The affected areas are usually itchy, but a person may also experience burning, redness, and soreness. Causes of type 2 diabetes. Insulin is a naturally occurring hormone. Your pancreas produces it and releases it when you eat. Insulin helps transport glucose from your bloodstream to cells throughout your body, where it's used for energy. If you have type 2 diabetes, your body becomes resistant to insulin. Your body is no longer using the hormone efficiently. This forces your pancreas to work harder to make more insulin. Over time, this can damage cells in your pancreas. Eventually, your pancreas may not be able to produce any insulin. If you don't produce enough insulin or if your body doesn't use it efficiently, glucose builds up in your bloodstream. This leaves your body's cells starved for energy. Doctors don't know exactly what triggers this series of events. It may have to do with cell dysfunction in the pancreas or with cell signaling and regulation. In some people, the liver produces too much glucose. There may be a genetic predisposition to developing type 2 diabetes. There's definitely a genetic predisposition to obesity, which increases the risk of insulin resistance and diabetes. There could also be an environmental trigger. Most likely, it's a combination of factors that increases the risk of type 2 diabetes. Risk factors for type 2 diabetes. Anyone can develop type 2 diabetes, but certain factors can increase a person's risk. These risk factors include being 45 years of age or older, living a sedentary lifestyle, being overweight or obese, eating an unhealthful diet, having a family history of diabetes, having polycystic ovary syndrome, PCOS, having a medical history of gestational diabetes, heart disease, or stroke, having prediabetes, being of African American, Alaska Native, Hispanic or Latino, American Indian, Asian American, Native Hawaiian, or Pacific Islander descent. Treatment for type 2 diabetes. You can effectively manage type 2 diabetes. Your doctor will tell you how often you should check your blood glucose levels. The goal is to stay within a specific range. Follow these tips to manage type 2 diabetes. Include foods rich in fiber and healthy carbohydrates in your diet. Eating fruits, vegetables, and whole grains will help keep your blood glucose levels steady. Eat at regular intervals, only eat until you're full. Control your weight and keep your heart healthy. That means keeping refined carbohydrates, sweets, and animal fats to a minimum. Get about half an hour of aerobic activity daily to help keep your heart healthy. Exercise helps to control blood glucose too. Your doctor will explain how to recognize the early symptoms of blood sugar that's too high or too low and what to do in each situation. They'll also help you learn which foods are healthy and which foods aren't. Not everyone with type 2 diabetes needs to use insulin. If you do, it's because your pancreas isn't making enough insulin on its own. It's crucial that you take insulin as directed. There are other prescription medications that may help as well. Diet for type 2 diabetes. Diet is an important tool to keep your heart healthy and blood glucose levels within a safe and healthy range. It doesn't have to be complicated or unpleasant. The diet recommended for people with type 2 diabetes is the same diet just about everyone should follow. It boils down to a few key actions. Eat meals and snacks on schedule. Choose a variety of foods that are high in nutrients and low in empty calories. Be careful not to overeat. Read food labels closely. Foods and beverages to avoid. There are certain foods and beverages that you should limit or avoid entirely. These include foods heavy in saturated or trans fats, organ meats, such as beef or liver, processed meats, shellfish, margarine and shortening, baked goods such as white bread, bagels, processed snacks, sugary drinks, including fruit juices, high-fat dairy products, pasta or white rice. Skipping salty foods and fried foods is also recommended. Check out this list of other foods and drinks to steer clear of if you have diabetes. Foods to choose. Healthy carbohydrates can provide you with fiber. The options include whole fruits, non-starchy vegetables, legumes, such as beans, whole grains such as oats or quinoa, sweet potatoes. Foods with heart-healthy omega-3 fatty acids include tuna, sardines, salmon, mackerel, halibut, cod, flax seeds. You can get healthy monounsaturated and polyunsaturated fats from a number of foods, including oils, such as olive oil, canola oil, and peanut oil. Nuts, such as almonds, pecans, and walnuts. Avocados. Although these options for healthy fats are good for you, they're also high in calories. Moderation is key. Opting for low-fat dairy products will also keep your fat intake under control. The bottom line. Type 2 diabetes is a common condition that causes high blood sugar levels. Early signs and symptoms can include frequent urination, increased thirst, feeling tired and hungry, vision problems, slow wound healing, and yeast infections. Anyone who experiences possible signs and symptoms of diabetes should see a doctor for an evaluation, especially if they have other risk factors for developing this condition. The early detection and treatment of type 2 diabetes can improve a person's quality of life and reduce the risk of severe complications. Having a support system that understands what it is like to have a diagnosis and live with type 2 diabetes is vital. Are you diabetic? Do you have type 2 diabetes? We have you covered. Check the description below for our #1 recommendation on the most effective way to preventing diabetes, type 2 diabetes. If you have any questions at all, please feel free to ask us in the comment section below and we'll respond to you as fast as possible. It's always our pleasure to help. Thanks for watching. If you like the video, please share with your friends and click the like button. And subscribe to our channel if you haven't already done so, and turn on the notification bell icon so you will be notified about our new uploads. We put out great and helpful content like this on this channel every day. Thank you. See you tomorrow.